When I came into this role, what I recognized and what people shared with me was there was a lot of activity because there's so much interest, anxiety, concern around COVID-19 and what it means to our community. And so there were a lot of people working on a variety of things. And some of that was also the county activity, the city activity, private activity, and just individual and organizational activity. And so what we did was a couple of weeks ago, said, how about we find a way to get people together so we can have more of a coordinated action so that we can work together in those areas where we have a shared interest and we can continue to make an impact, hopefully even greater. The other piece that I want to touch on today, and I'm going to spend more time on that, is the data. I've been asked, and I know you're looking at a lot of data, and I've spent a fair amount of time analyzing that data so that we could get some sense of what this means. And the last, as I mentioned, is how to be safe in the midst of a protest for those who are choosing to do so. So these are the metrics that I've gathered initially to look at. And there are a lot of different really good tools out there that have been assembled. People are working very hard to make them publicly available as well. But we're looking at 5 areas. What are the trends we see in the virus? What is our ability to treat? So what's our capacity? We know that we initially flattened the curve so that we could make sure that we had the treatment and care capacity within our hospitals and healthcare systems most specifically. What are the results with testing and how are we placing testing? Contact tracing, which is fundamental to public health efforts and to prevention, as well as what are we doing in terms of select or vulnerable populations. So these are the measures that we're looking at, and what you can see here is that I'm cautious. As Tristan said, we've had 300 cases today. We had 298 cases yesterday. So we've had this continued increase. So what I'll say is we don't yet know what our peak is, and I don't think based upon the data that we can say we've peaked. We're also looking at the percentage of positive tests that are occurring. That's a number we're tracking, and when we look at that, we're looking at the number of tests as well as the number of positive tests as well as the number of tests conducted. The hospital admission rate, we are tracking that to make sure that we have sufficient capacity and also to make sure that we're not seeing a spike in that. We've monitored the percentages of hospital and ICU admission as well as ventilator use, and I'll talk a little bit about that in a minute as well in more detail. And of course the deaths. Checking and tracking those deaths to see when they're occurring, when they're being reported, so we can see if those numbers are going up or down. Right now, as I said, we're kind of in the caution window. So the way that I look at these metrics that we have progress, we have caution, and then we have high degrees of concern. So you'll see that's going to be the case for each of these. Our ability to treat and manage, we're monitoring our capacity as you are as well, and so about 68% of our hospital beds are occupied. What does that mean? We're looking at the ICU capacity, the ventilator capacity, as well as we're continuing to have ongoing discussions around the personal protective equipment, recognizing that's necessary to treat. I continue to get information to make sure that our major hospital systems have an adequate supply, which we've said needs to be at least 4 weeks. You can see right now, based upon where we are in ticking on capacity and some of these other things, we feel like we're in the positive window. If we had a surge or a spike, we have the capacity to treat and manage. Testing. That is something that we focused a lot of energy on. We have worked on not only standing up the community-based testing centers, working with private testing as well, also creating mobile testing and expanding that, and I'm also pleased to share that we've been working over the last week or so trying to look at various factors. Who's the most vulnerable based on data? Where are we seeing the highest risk of cases? Where do we see testing placed already? And how do we make that testing more accessible? So we're going to be rolling out over the next week additional testing sites that will be walk-up testing sites so that people can get to them. And our goal is that you'd be able to get to them within 15 minutes on foot. There are other measures that we're looking at relate to contact tracing. And contact tracing, the reason that it's not coded is because we haven't gotten the data from the county yet regarding contact tracing. As you are probably aware, the county has been undergoing an evaluation of their contact tracing apparatus, and they will be making an announcement tomorrow regarding the changes there. What I can say is that they've dramatically increased the number of contact tracers. We have a ratio that we're working through to make sure that we have the right number of contact tracers per person, and also how we use technology. Vulnerable populations or select populations, we're referring to them in that way. We know that there is a disproportionate share of the population that is having an impact by COVID-19. We can look at the national data and see it in African Americans and some other communities as well. Here we're seeing it more substantially in the Hispanic community. I've spent a lot of time over the last week meeting with leaders in the Hispanic community, understanding what we are seeing there, understanding some of the special cultural and other considerations, and also how we put testing closer to them and within their community. And that's going to be part of the new testing that we're rolling out over the next week as well, so I'm pleased to say that. We also recognize that we're seeing a disproportionate share of hospitalizations also within the Hispanic community largely. And so we're very cautious and concerned about where we are there, and that's why the dial of the needle rests there. So one of the things that I mentioned in opening is that we have recognized, and you do too, that there are two historic events taking place right now. Protests around racial injustice, as well as what we're seeing with regard to the pandemic. With that, we've created a 10-step guide to peacefully protesting during a pandemic. We are looking to distribute that and disseminate that as widely and broadly as possible. It has evidence-based guidance in there for law enforcement officers, individuals who are protesting, as well as individuals who may become exposed to those who've been protesting. What I'm also pleased to say is that today and tomorrow there is testing available to protesters at American Airlines Center, which is walk-up testing, so to take advantage of that. And we're also working with other partners and institutions to make that testing available to protesters for as long as these protests continue. With that, I will end my presentation and take any questions that you may have.
Dr. One of the things that obviously the high numbers today, we don't know if that's reflective of the protests at all because there's an incubation period. When do you expect to see evidence of whether there are any problems or widespread of COVID-19 among the actual protests?
Thank you. Well, the incubation period is about 5 days. So we're looking at a window of 5 to 14 days to be able to determine, did we have an impact on the number of infections based upon the protest. And so we still have a window, which is why we want to get this information out, which is why we want to tell people to wear masks, to protect themselves, use hand sanitizer. And also, what's very important is if you have underlying health conditions or you're coming in contact with people who do, to consider another way to be able to express your voice.
Can you, Doctor, tell us what do you think is the reason why cases have been so high? Why we get that 300 markers in Memorial Day, the fact that Texas reopened, and can you also elaborate where those walk-up sites are going to be rolling out, and what parts of Dallas are going to be in primarily?
Yeah. I think it would be speculation for me to be able to say why the numbers are where they are. We're still working on getting more complete data to be able to speak to that. So where may they have been and what may they have become exposed to? What we do know is that the more we test, and fortunately we're increasing our volume of tests, that we should expect that we're also going to get more positive cases. So that's something that I want to make sure that I do convey. In terms of the sites, as of today, we'll have somewhere between 5 to 7 new sites. And those sites, we use various factors. I mentioned some of them earlier, which is where do we see the most vulnerable population based upon some of the data that we have? Where are we seeing the highest rate of new cases? Where is there walk-up accessibility? So where can we place it? Trusted community sites are what we're looking for. I recognize in multiple conversations with various communities that some are more reluctant to go get tested for a variety of reasons, so we want to make sure we're considering that, and also in areas where there's limited testing available. And so we'll have that, and as we have done with other things, we'll have it posted on the website as soon as we finalize all of that. The reason that I'm not able to share is, one, the recall around it in every specific site, but also because the City Council just voted to support that new testing rollout.
Doctor, as far as the proportion of hospitalizations,
I think it's a combination of many factors. One is we're seeing higher rates in individuals that have underlying diseases. One of the most prevalent one and prominent ones is diabetes. So that's one. Two is we are seeing higher rates of hospitalization amongst our essential workers. The data is showing us somewhere between 75 to 80% of those who are requiring hospitalization for COVID-19 in Dallas are essential workers, and we also know that members of the Hispanic community make up the largest proportion of many of those essential worker categories.
Are any of these sites that you were mentioning that go towards maybe like areas high number of minorities like African Americans and Hispanic?
Yes.
There's a lot of the health deficits also in those areas.
Yes, and so as we've looked at the data, what we recognize is that when you take those factors that I just shared and you layer them over, vulnerability and some of these other things that I'm talking about, just based upon the way we've labeled them in some of the other data that we've done, is that those populations are the ones who are at greatest risk for this. So yes, you will see more testing being made available. And not only that, that's why we're also embarking on the rollout of more walk-up sites, because we recognize that in some of those communities, transportation and access to reliable transportation is less secure than in some other communities.
We have heard that 800 number, I believe, from researchers at UT Southwestern saying if habits continue the way they are, with people getting back to some sense of normal, that would be our daily case number. Is there any thought when we look at the growth rate right now that we're on track for something like that?
No. So I know there are a lot of different models out there and have deep respect for UT Southwestern. What I can also say is that as long as we continue to practice some of the things that we know work, then there is the opportunity to continue to not maybe flatten, but to reduce that. All right, so I think we're still too early on with some of these numbers that we're seeing to be able to speak to, are we on track for 800? The protest and what's taking place there, aspects of the reopening, adherence to personal protective behaviors and precautions, and also being selective when you choose to go somewhere. So all of those factors will really help to determine what the numbers are going to bear out. I think it's too early to call it a trend, but it certainly is concerning at this point in time. But I can't say that it's 800. The fact that it's increasing is a concern.
You essentially have been kind of saying throughout the presentation how you grade testing, so on and so forth. Contact tracing.
Yeah.
Can you kind of walk us through that a little bit more? Because it sounded like you'd like to see more of it, and like to know a little bit more, what more we could do, or Department of the County to do more. Can you kind of talk more about what you would eventually like to see and how can you improve on it?
Yeah, I think it's fair to say that not only would we in the city like to see more contact tracing, but the reason that the county is moving forward is because they also agree. We recognize at this stage we should be getting a lot more identification of positive cases from contact tracing. So one, you have to increase the number of tracers, because most of this is I'm going to reach out to somebody by telephone, and I need to be able to do that quickly. We want to make sure that that telephone call or that contact to that potentially exposed person happens within 24 hours after the results have become known, because that's also when it's the most valuable. So there are a number of things here that have to be improved, and I think it's fair to say that the county agrees and is working very quickly to make those improvements. I can't comment on specific data because, as I said, we have yet to get sufficient data to be able to know how many people are being identified, how many people are being contacted, how many of those are expressing symptoms, and how many of them are going to get tested. And that's the kind of information that we need.
What's the biggest obstacle to try and improve that?
What they're doing, which is you need a lot more people. You need people quickly. You need well-trained people. And you also need those who are contacted to pick up the phone. When they're reached out to respond, to recognize that we're acting in their best interest, and we need them to engage in this process as well. There are no other...
Just for, if I was protesting tomorrow or tonight, what would you just tell me? Because I think obviously 6 feet is something we've all heard for a very
Yes.
long time. But if you follow these protests, it's very difficult to do that. What have you seen, via, on TV? And what would you tell the protesters who might be heading up tonight or tomorrow?
First thing is I would make sure that I understand it's as best you can, your own health status. As I said, have an underlying, and by that I mean if you already have diabetes or respiratory illness, something that could put you at greater risk for getting COVID-19, then find another way to express yourself as opposed to going into a large crowd with a lot of unknowns surrounding it. Second, if you're going into these protests, make sure that you're wearing a mask, as much as possible maintaining a safe distance, and that you also have hand sanitizer. The next, I would say, is if you're going back into an environment where there may be people who are vulnerable because of their health conditions or because of their age or some of these other factors, monitor yourself and your symptoms, and also make sure you're doing everything to continue to manage your hands and any contact that you may be having with them as well. And if you begin to develop symptoms, that's why we're also making testing available today and tomorrow, and that's why I also mentioned that we're working with others to make that available on a longer term basis, as long as the protests are continuing. That's what I would offer. What I would say to everybody is that what we know works are the personal protections and precautions, and to also to exercise good, sound judgment around where you go and when you go. As I mentioned, we've created a 10-step guide, in a sense, to protesting during a pandemic, and what we're also looking for are sources to be able to disseminate that as broadly and widely as possible. So if you're interested, that's something that we'd also like to be able to share with the public. Thank you.